Luther, Katie Price, previously known as Jordan, is a massive celebrity. She's well known. Everybody has an opinion on her, and a lot of people have an opinion on how she looks and how she has looked in the past, because she has had a lot of cosmetic enhancements. She's had breast enlargements, breast reduction. She's had fillers in her face. She's had all sorts of different ways in which she has changed her appearance. Now, she has told a podcast, she's 45 years old, and she's told a podcast, there is nothing worse than when these young girls now, and I will say it, in their early 20s, who are all getting fillers, all getting lips, all getting the boobs. I'm not a hypocrite, but I didn't start doing my face until I was in my 40s. Yes, I had a boob job, but I didn't even have fillers. She shared graphic images a few years ago from a trip to Turkey, where she had procedures including full body liposuction, eye and lip fillers, lifts, and all sorts of things. She said her numerous cosmetic procedures had probably deterred her own children from having surgery. It's really interesting because there are a lot of young people who've come through lockdowns who are looking at the images in the media and advertising and so on. You've got to look perfect. And I just wonder about this, actually. Is there an obsession by young people to have cosmetic surgery or to look a certain way? Older people as well. And would you have cosmetic surgery? Is it a good thing, actually? Does it help you take a bit more control of how you look and how you present yourself? We're going to get a number of thoughts on this. And if you have had a procedure, or you're thinking of one, or perhaps you think they're awful, let us know your thoughts. 0344 499 1000. I know we've been talking a lot of politics today, but I want to talk about this issue as well. And I'm delighted that Dr. Barbara Kubicka, who is an aesthetic doctor and founder of Clinic B, is with us now, as is Faustina Anyanwu, who is a founder of Divas of Colour. Faustina, perhaps I could start with you, actually. What do you think the problem here is, or is there a problem?
Yeah, thank you so much. First of all, we need to think about, why do people want to, opt for cosmetic surgery? Usually it stems from some psychological or social, pressures, which are mental health issues, and those need to be addressed before a young person is allowed to do cosmetic surgery, because cosmetic surgery is a real surgery, just like any other surgery. Children or young people, there's always an exception before they are allowed to, go for procedures that has to invade.
So do you think, Faustina, are you sort of saying there should be checks and balances, perhaps, in regard to people's mental health in terms of the procedures and the consent there? I mean, how far would you go with this, Faustina? Surely people have autonomy over their own bodies.
Yeah, young people, first of all, majority are still growing, are still developing their bodies. And some of them also, you need to understand, why is this, where is this coming from? What is the motivation for that? What is their expectation of the plastic surgery? Do they understand the limitations of plastic surgery? These are the assessments that need to be done, so that the child or the young person doesn't go into plastic surgery with wrong expectations and then end up worse.
What do you make of Katie Price herself warning against this? I mean, she is probably one of the most famous people in the United Kingdom for having countless, dozens of cosmetic procedures. Does it mean it's more powerful coming from someone like her rather than someone who hasn't had cosmetic procedures?
Yes, I think she's the best case study in this issue, because she's had several procedures on herself, and she has seen, by her own experience and by herself, seen several changes in her body, and she knows that once you have changed something, you can't get it back to how it was before you did the surgery. So she understands very well the consequences of cosmetic surgery, and I think her advice and her words should be taken more seriously than any other person.
Okay, Faustina, stay there. Barbara, I want to ask you about this. I mean, you're someone who runs a clinic, actually, Clinic B, and you undertake cosmetic procedures, as I understand it?
Yes, that's correct. Thank you for having me here today.
What's your perspective on this?
It's a very difficult subject, because obviously, for me, aesthetic treatments are something that it's supposed to help and enhance people's confidence, help them looking best, take control of their aging, or give corrections, allow corrections to their look. But everything in exaggeration is wrong. And as well, a lot of young people, as you said, the reasons why they're doing procedures are not really thought through, or they are influenced by social media or peers or celebrities. So in that situation, I feel like the big responsibility lies actually on doctors and on us who should assess what are the reasons, advise against sometimes, and as medical professionals, we have duty of care, which means that we have to take in consideration the well-being of that individual. The problem is that industry it's poorly controlled
and regulated. So what do you do at your clinic, Barbara, to make sure that people aren't doing these, having these procedures for the wrong reason? I mean, if someone just walks up and says, right, I want a load of lip fillers, do you just say, right, fair enough? Or do you actually ask them why they want them, what their reasons for it are, and look into that a bit? I mean, it's interesting because whilst people should have freedom of choice, there are obvious implications in terms of how people view themselves, Barbara.
So in our clinic, in Clinic B, we start with the lengthy questionnaire. So the part of the questionnaire, it's the psychological well-being. So we assess how they see themselves, what are the other issues, whether they suffer with anxiety, whether there is anything that we can spot directly in that way. There are studies showing that people who seek aesthetic treatments or cosmetic treatments, there's increased number of people suffering with body dysmorphia, and that means that they don't see themselves as people outside see them. So they focus, for example, on their nose, on their lips, and the moment they change it, they want to change something else, and that's what it's so disturbing because it's addiction. It becomes something that the treatment becomes a mask to the things that is happening inside. But saying so, there are ways of filtering this through obviously the consultation and then speaking to our patients in depth. So we give a lot of time to do this. And as well, I'll be very alarmed if when someone comes and show me, for example, picture and say, oh, I want the lips like this. It's not about me producing lips like somebody else's. It's about the person that is in front of me and their well-being and how they
what is your view, Barbara, on tattoos? Because they're permanent as well, and people can very easily get tattoos, and very many of them in some cases easily and quickly, and to a relatively low cost as well.
It's a very not the same, but it can be damaging to the look, and it's permanent. And even with the lasers and ability to remove them, it's never completely removed, and they release the scar. So I think the industry is very unregulated, and all those treatments should more care and awareness in terms of consequences. And
I want to come back.
That's a good discussion. Yeah.
I want to come back to you in a second, Barbara, but I want to get Faustina's angle on a couple of these. Penny in Essex has been in touch on text and says, Peter the Great, she calls me, that's very kind. Fab show as usual. Kitty Price talking about cosmetic surgery and young girls not having it is the kettle calling the pot black. I can understand he has a really crooked nose, or somebody has a crooked nose, or someone which is obviously affecting their life. But Kitty Price was a lovely looking woman who, like the majority of people who go under the knife, go too far. They all do it, they all end up looking unrecognisable and sometimes grotesque. Sometimes the car tire lips are the worst. Why do they do it? Says Penny in Essex. And that's actually a sentiment echoed by Julie, who's also been in touch on text to say, Peter, I am speaking as a qualified counsellor. If someone wants surgery to make themselves feel better in themselves, then so be it. What I would love to do is to give people counselling sessions first to discover their self-worth and self-esteem. Therapy works. These companies are taking advantage of people. What do you think of those two sentiments, Faustina? And then I'll come back to Barbara.
Yeah, first of all, talking of Katie Price's, someone saying he's a hypocrite or something like that. No, I don't see it that way. She has experienced this. She's gone through it, and she knows, she knows the consequences. She's seen it herself. She's experienced it, and I think from her words, you can see that if she can wind the clock back, she might take a different step to what she has already done to herself, and if you can see some of the pictures if you compare her pictures, through the series of the cosmetic surgeries that she's done, you could see the changes. And I'm sure, like the doctors just said now, once you do one thing, especially the surgeries that are for changing how you look or whatever, like for example, you want to do nose job. Once you do that, you find out that it wasn't properly done as you wanted it, and then you want more, and then you want more, and then it become an addiction.
Do people get addicted to this? Let's ask someone who does these, some of these, or runs a clinic anyway that does. Barbara, do people get addicted? Do you see the same clients coming back all the time?
Unfortunately, in my clinic, it's not such a problem because I said we either natural treatments or natural looking treatments. So we do manage that. It's true. We had over years, we had clients who wanted more and more. And because of self, as I mentioned before, the brain works in a way that when we focus on one thing, when we fix it, and when there's underlying condition of poor self-worth or issue with self-perception, there will be desire to do more. And then, for example, when you fix one line, then they think that they have another line or another.
Do you mind me asking, Barbara? I mean, a lot of people are listening on the radio. In fact, the majority of people are listening on the radio. But some people are watching on Talk TV. But and they will see you and look at you. And as is the case when people look at me, they will make a judgment about how I look or whatever. But I mean, have you had any treatments yourself? Any forms of cosmetic enhancement? If you don't mind me asking, Barbara, it is germane to this discussion.
Yes, absolutely. It's not a problem. Yes, I did. I have done and I've tried many of treatments that we offer in the clinic.
Well, what have you done, if you don't mind me asking?
Oh, I'm a huge advocate of PRF and natural fillers, which are based on your own blood, and we use and prepare the gel out of it.
And so PRF or fillers, what, on your face, around your lips, your eyes?
It's not. It's not the filler. It's the PRF gel. So it's your own blood, which stimulates your collagen. Okay. So I like very much natural treatment. So it's everything that will stimulate the collagen, help with looking fresh, and help with my skin. And we do treatments as well, like those treatments for the skin, for the hair, like mesotherapy, injections of vitamins, amino acids, to make the skin looking better. And so you just about enhancing your own appearance. And yes, there are certain corrections that I would do if I wanted to look better.
Barbara Stewart in Scotland says, Peter, I think all cosmetic surgery ought to be solely for accident victims with burns and scars, and of course women who've suffered breast cancer. What do you make of that sentiment from Stewart in Scotland?
I don't agree with that, because I believe, is what you said earlier on, that we can decide about our body, and we should be able to create the changes if we want to. But it's all about moderation. It's all about seeking professional advice, being able to choose things that are right for you and think through those treatments and those decisions, rather than make impulsive decisions based on social media or celebrities.
It is difficult, though, isn't it? A final question to Faustina. Graham in Bushy has been in touch on WhatsApp. He says at every cosmetic clinic they should have a picture of Kitty Price with a sign underneath saying, do you really want to look like this? What do you make of that?
I wouldn't advocate for that because, of course, Katie Price had her reasons for, going through those procedures and stuff like that. But just like we have with cigarettes and other things, I think there should be kind of warning and to let people see or know the kind of side effects and or what could happen, or what could, how they could look afterwards, and know that they cannot get their natural look back once the procedure has been done, especially the invasive ones like, actual cutting of the body and stuff, like probably fillers or something could be removed that the person could go back to how they used to look. I don't know about that.
Okay.
But for me, I would say that, before someone goes to cosmetic surgery, for example, because of body dysphoria or something like that, I think we should consider counseling, counsel the person, try to get down to the root of why the person is feeling that way. Can there be a psychological way of fixing that problem for them. For example, almost every young person at one point, have insecurities. Myself, I have some insecurities while as growing up. But as I grew, I began to like even those things that I was insecure about. So every human being grew up having some insecurities. And then if I can address the issue of if people have accident or
Yes, of course. Go ahead, Faustina. Yeah.
Yeah, those are exceptional cases, of course. And there has been an accident, something has already changed in that person's body, and the person don't like that one. That is completely different. That's a treatment.
Yeah, well, that is a different issue. Yeah,
exactly. So it's good for the person. That's I don't think that's part of the
it's a related but separate issue. I totally agree with you. Faustina Anyanwu, thank you very much indeed to you. She is the founder of Divas of Color. Thank you also to Dr. Barbara Kabishka, who is an aesthetic doctor and founder of Clinic B. What do you think about this? There's still time to get in on